so we can go eat now. Okay? Bye. 5 second rule, man.
4 days later.
Yo, Dave.
Next, Mr. Kukamore. This way, please.
Good morning, Mr. and Mrs. Kukamore. How are you guys doing?
I'm good, thanks, and you?
I'm good. How are the children doing?
No, the kids are alright, man.
I'm glad to hear
Am I
that.
not the patient here, man? Why are you the one responding?
I haven't seen you in a while, so what brings you here, Mr. Kukamore?
No, doctor, my wife is just exaggerating,
Hy
man.
lieg, iets is verkeerd.
I know you're not the type to get sick, so surely there is something wrong if your wife says so.
No, doctor, man, I just have a fever. My muscles and joints are painful, man, and I have diarrhea.
Okay, let me just jot that down. Fever, muscle pain, what else? Diarrhea, and joint pain. So how long have you had that for?
He's been sick for 4 days.
Okay, 4 days. Based on your medical history without any chronic illnesses, this should go away in like 5 days or so. So I'm gonna prescribe 10 grams of doxycycline, and after taking this, you should be fine. Here.
You gonna drink this? Cause you brought me here.
No.
I'm not gonna
Calm
drink
down,
no
calm
pills,
down.
man.
I hope you get better soon, but this should go away. It's not a serious case.
Told you, shouldn't have wasted our time
You
coming
can
here.
leave the kids, though.
Thank you so much.
Thank you.
Enjoy the rest of your day.
Thank
I'll
you,
see
doctor.
next time.
Thank you.
It's a pleasure.
Miss Mashaba flew in from Malaysia and has the same symptoms as Mr.
So, Ms.
Kukamore.
Mashaba, what seems to be the problem today?
Doctor, I don't know what's wrong with me. I have a fever, I have diarrhea, I'm just dying. I have sore joints, my eyes, kick my eyes.
So, have you been traveling?
So yes, I just came back from Malaysia a week ago, and yeah,
And has the symptoms started since you came back from Malaysia?
about 5 days ago. So
Okay, so what I'm going to do, I'm going to prescribe medication to you. And you have to take them and you'll be fine. If the symptoms persist, you can just come back. So you said you have eye infection, diarrhea, muscle pain, and headache,
fever.
and fever. So all you have to do is take this doxycycline and you'll be fine.
Okay, thank you, doctor.
You're welcome.
Good morning. I'm here for the results of Mr. Kukamore, the blood samples and the urine samples.
Oh, I have the reports right here.
Oh, okay.
We performed the MAT test and the ELISA test, and both of them came back negative for Mr. Kukamore.
Oh.
No antibodies were visible here, so I doubt he has leptospirosis. And then we performed another test for Mrs. Mashaba. This one came back positive to show that there are leptospirosis antibodies. And using the dark field microscopy, let me move, you can clearly see,
Just have a look.
the leptospira appears tightly coiled. Can you see that?
I can see what you mean.
And it's motile.
It's very visible. Wow, okay. So these are the 2 tests, and I will just give them to the doctor in charge, and he will just have to deliver the news to the patients.
Okay.
Thank you.
Okay.
Okay, Mrs. Kukamore, how are you feeling today?
He's not getting any better, doctor.
We've run all the tests. We've run a test for leptospirosis, but it came back negative. will give him some more antibiotics.
Thank you. So basically I'm dying. That's what you're trying to say, that I'm dying.
Mr. Kukumur, we can't say for sure what is wrong, but we will give you more antibiotics and we'll see.
Aren't you the doctor, man? What do you mean? You don't know what's going on with me?
Mr. Kukumur, we will run some more tests and give you more antibiotics and we'll try our best to help you.
In other words, I'm dying.
We don't know what's happening, Mr. Kukumur.
Thank you, doctor.
You're welcome, Mrs. Kukumur.
Where's my husband?
I'm sorry, ma'am. I'll just
No,
call
no,
the
no,
doctor.
get
No,
the
let
doctor
me
and
go
tell
get
me
the
what happened.
doctor.
Tell
I'll
me
be right
now.
back. I'll be right back.
Where's my husband?
Good afternoon, Mrs. Kukumur.
What's going on?
Unfortunately, we have bad news. A day after Mr. Kukumur was moved to the ICU, we had some atrial fibrillation and he died of cardiogenic shock. I'm so sorry for your loss, Mrs. Kukumur. I'm so sorry.
This is deceased patient number 275, Mr. Kukumur.
Okay. According to our files, and when we did a few exams, we saw that he died of heart failure caused by cardiovasculitis and myocarditis, which was caused by leptospirosis. When we took x-rays, we found that he had cardiomegaly and hypertrophy in the left ventricle. Upon histopathological examination, it seems like the interstitium of the ventricular myocardial cells showed an inflammatory infiltrate with focal myocycle necrosis.
Morning, doctor.
Good morning, Ms. Mashaba. How are you feeling today?
Oh, much better.
That's wonderful. So, Ms. Mashaba, what we have found, we have done a test and you tested positive for leptospirosis.
What's leptospirosis?
Leptospirosis is a zoonotic disease transmitted by rodents.
Rodents.
Or, in your case, as you have been overseas, it is also transmitted by water activities.
Oh, so if the water is infected, then
There's
I
a
have
chance
chances
that,
of...
yes.
That explains it, because I have been swimming the whole time when I was
Yes.
overseas.
So, since we have detected it in the early stages, you have a mild leptospirosis. So, since we gave you doxycycline, we are going to prescribe you with amoxicillin.
So does that mean I will be fine?
Yes, that does mean
Clear
that
off. So how could I have prevented getting leptospirosis?
there are many ways that you can possibly contract the zoonotic disease. However, you can prevent that by eliminating contact with infected animals or avoid swimming in areas that could possibly be contaminated.
Oh, okay. Well, thank you, doctor. I will definitely keep that in mind next time.
Excellent. Good afternoon, Mrs. Kukumur. Afternoon. So, Mrs. Kukumur, we've got the results of the post-mortem and we found that Mr. Kukumur passed away of leptospirosis.
How did you guys not notice this? What happened?
Because we gave him antibiotics, this caused us not to pick it up the first time. But in the post-mortem, we found that he passed away of... The cause of his passing was leptospirosis that led to cardiovasculitis. I'm so sorry for your loss.
Socioeconomic impacts of leptospirosis are productivity of animals used for food, cost of labor to replace workers affected by leptospirosis, money to replace own inability to produce food for your family, and cost of special diagnostics surveillance for leptospirosis.